One thing I often say to clients is, don't use that over-the-counter medication to treat your cat. A recent study on feline herpes virus may have me thinking twice about that statement. Hi everyone, I'm Dr. Ross. This recent article in the November 2025 issue of Research in Veterinary Science evaluated the over-the-counter, off-label use of 1% Penciclovir Cream in cats with chronic herpes virus. And the results look promising. Anyone with a chronic herpes virus cat knows herpes virus is a pain. Flare-ups come out of nowhere. Treatments help but don't cure the disease. And then upper respiratory infections progress, often resulting in congestion and sometimes require an antibiotic to address a secondary bacterial infection. L-lysine, which was initially considered to be a game changer in the treatment of feline herpes virus, is now thought to do nothing to alter the course of the disease, despite many cat parents saying it does help long term. Penciclovir has been proven to help. However, it's a pain to give because the tablets are so large. Compounding does not eliminate the bitterness, which obviously cats do not like, and it can be a costly medication because high doses are required to reach therapeutic levels in the body, and in some cats, treatment protocols can last for weeks. Now enter 1% Penciclovir Cream. Famciclovir is just a different version of the active ingredient in the topical cream we are chatting about. Famciclovir is converted to penciclovir in the body, and because a cat is a cat, we don't really know exactly how this is done when compared with other species like dogs and humans. Essentially, what we are doing with this cream is putting what famciclovir is broken down into by the body directly into a cat's eye. In this study, cats were treated with the 1% Penciclovir cream directly applied to the cornea and an artificial tear ointment. The meds were randomized for each cat, with one eye receiving the placebo and the other eye receiving the Penciclovir cream in the same cat. This was done twice daily for 3 weeks. Owners were asked to report their observations. Additionally, ophthalmic exams and ocular tests were performed in each cat. Wait. Are we talking about the antiviral cream? You know, the one used to treat herpes cold sores on the mouth? Yep. And I'm supposed to put this cream in my cat's eyes? The same one people put on lip cold sores? That's what the investigators did in the study. The non-active ingredients in the cream are safe to put into the eye. And that's exactly one of the things the investigators were looking at. Does a topical cream that is generally applied to the skin cause irritation in a cat's eye? 85% of cat parents in this study reported no issues. Symptoms like mild redness and discharge made up the other 15%. The picture on the left is a picture from the study showing mild eye irritation in the cat's left eye immediately after applying the cream to the eye. The study found there really was no difference between the medicated eyes and the placebo eyes. When mild irritation was noted, it was self-limiting, as illustrated in the picture on the right, 24 hours after stopping the medication. These findings are similar to other antiviral medications applied to a cat's eye, like idoxuridine, and it was noted that many eye creams and ointments currently available also cause mild irritation in some cats. They did notice that the corneas were more sensitive in the eyes treated with the Penciclovir cream after 10 days. No concrete conclusions were made about this observation except to say more studies are needed. In addition to being well tolerated by a cat's cornea, the cream achieved and maintained therapeutic levels in the tears for over 8 hours after administration, something that is hard to do and very helpful when treating herpes virus. And this is probably why a whopping 80% of cat parents said the cream was effective or highly effective in treating herpes virus. Wow! Bringing this back down to reality, this study was done in healthy cats. Real-world herpes virus may not respond as positively to the cream in the eye as it did in the healthy cats in this study. Even though on average Penciclovir was active in the tears for over 8 hours after administration in most cats, it wasn't the case in all cats, and individual variability will have to be considered. This study also relied on cat parent observations that naturally carry a bias that randomized controlled studies with clinical patients tend to avoid. And these cats were only treated for 3 weeks, so we know nothing about using this medication long term. Although this looks promising, using this medication is still off-label, which means it is not approved for use in cats. Nonetheless, studies like these are exciting in that we potentially have another option, one that is convenient and cost-effective for the ongoing battle against herpes virus in cats. Let me be clear. I am not saying run to your nearest drugstore and start squeezing cold sore cream into your cat's eyes. While the results from this study are promising, more studies with more cats is absolutely required before we can recommend this as a safe and effective eye treatment for herpes virus in cats. The goal is to repurpose this common medication for use in cats one day, effectively having another tool in our herpes virus toolbox. If you have any questions or concerns, please consult your vet. If you want to learn more about herpes virus in cats, then check out my feline herpes virus video. If you enjoyed this video, like, subscribe, and comment. Thank you so much for watching, and I'll see you on my next video.